Let's review those building blocks again with something hard. We'll use Epic, the USA's biggest provider of electronic medical records, because they sell to customers who work at enterprise-level healthcare organizations. A customer is a person who spends resources to make progress. Epic has multiple customers. Clinicians are Epic's end users. It seems that most physicians and nurses don't like Epic. Data entry takes up more than 50% of their workdays, but Epic has been so successful at addressing paying customers' JTBDs that end-user dissatisfaction hasn't thwarted sales. Chief Information Officers are Epic's strategic customers. CIOs control some portion of their organization's budget, or they have the power to get budget items passed. CIOs go to bat for Epic inside of their organizations. They argue that the product is valuable, and they have the power to get money from the Chief Financial Officer to dedicate to a purchase. CIOs are also Epic's technical customers. CIOs are responsible for the technical rollout of Epic in their organization. Chief Financial Officers are Epic's economic customers. They commit funds to the purchase. They can block CIOs from purchasing Epic. There are additional auxiliary forms of paying customers who can impact the decision to purchase too. Chief Executive Officers, Chief Medical Officers, and Chief Medical Informatics Officers all could block the sale. A job to be done, or JTBD, is a particular type of progress a customer struggles to make in a distinct context. CIOs might have a JTBD that looks like this. I want to offer the highest quality medical information available to everyone in our health system. CFOs and CEOs might have the JTBD. I want to maximize revenue from every interaction patients have with clinicians. Epic has to understand and serve the unique JTBDs of CIOs, CFOs, CEOs, and every other paying customer who could help or block the sale. And they need to understand clinicians' JTBDs as end users. A product is anything sold to customers to remove their barriers to progress. Epic sells EMRs that are good at addressing executives' JTBDs. For context, medical records used to be a way for clinicians to track patients' medical histories. Epic automated the use of patient information to generate bills for care, so medical records collapsed into a billing technology. Competition is anything customers do to address their JTBDs in the real world. Epic competes with other EMR vendors like Cerner, Athena, McKesson, Siemens, and Allscripts. But Epic also competes with homegrown EMRs. Originally, Epic competed with paper medical records paired with paper billing. They also competed with Do Nothing, have no medical records whatsoever. As they've grown, Epic's expanded their offering to cover far more JTBDs. In a broad sense, they've ended up competing with hundreds of additional medical software companies and homegrown solutions. Positioning refers to the way customers distinguish products from real competition. Epic originally positioned itself as more effective at billing via record keeping than paper. That's a quality play. Epic sent teams of engineers to work on site with CIO's engineers, so when CIOs considered buying products from new vendors, Epic could offer to build the same products on site instead. Epic blocks new competition from entering their territory by offering to build similar products on site with custom integrations in their platform. That positioning is based on quality too. Epic software may not be higher quality than its competitors, but the pain of adopting and integrating new products is eased when it's all done by one massive dev shop that's already integrated with the system. Health systems paying customers avoid the headache of working with multiple software vendors that way. A market is the total value of all resources customers spend to make progress on a particular JTBD. Epic's global market includes all of the resources spent, where the JTBD, maximize revenue from every interaction patients have with clinicians, overlaps with the JTBD, offer the highest quality medical information available to everyone in our health system. That market happens to include a chunk of patient experience, clinical efficiency, specialty care support, telehealth, revenue management, managed care, population health, regulatory compliance, and bagel sales. Just kidding about the last one. But we wouldn't be surprised. Epic's eating everyone's lunch because of their positioning. Segmentation is the process of dividing a market by customer attributes. Epic could meaningfully segment their market by organization size using number of beds, clinicians, patient populations, or revenue. And Epic could segment on competition. Who in the market is using paper medical records? Who uses Cerner? How recently have those products been adopted? Targeting is the discipline of focusing on a particular segment that includes customers with the most attractive attributes. Epic started by targeting customers with the job title CIO at major research hospitals. Profit margins at health systems like this are usually thin, even though a ton of revenue passes through the system. Their costs are high, so everyone, including CIOs, are under pressure to maximize revenue. Epic should also narrow its focus to CIOs who are in the right timing window to buy. A CIO who just spent 18 months rolling out a multi-$100 million deployment of Cerner would be a poor target, for example. Diffusion shows how products spread through a market. This is where Epic made its most strategic moves. Their initial target customers formed a cohesive segment. These CIOs attended the same conferences, read the same publications, and shared tips with each other over lunch meetings. Epic targeted this small segment with direct sales first. This segment was full of early adopters and innovators who had failed at building their own homegrown EMRs. And then Epic lobbied the US government to pass laws that financially incentivize their paying customers to buy other medical practices. These hospitals bought smaller hospitals and built hospital chains called health systems. And those health systems bought medical groups, and they bought small private practices. And almost every time a health system acquired a hospital or group or private practice, the CIO at the top forced the newcomers to abandon the competition and adopt Epic instead. That was Epic's main diffusion strategy. Entrench themselves in one segment, and then make that segment so powerful that it could gobble up other segments and spread their product to the whole market. Epic has fierce competition, but their diffusion strategy has been so successful that they now hold medical records for 62% of all patients in the United States. Pricing is a mutually beneficial exchange of economic assets. Epic's pricing is heavily customized for each organization. Their starting prices range from $1,200 to $500,000 per month. Some of their contracts include hundreds of millions or billions of dollars committed up front. But don't worry, CIOs are also paying for an embedded team of engineers on site who can provide support and build whatever they need, and protect Epic's position. It's a really smart approach. Epic could get dethroned any day, but it's safe to say that they've had a good run. It can be complicated to sell into enterprises, but well-structured interviews make it much, much easier to map out a sound strategy that saves a ton of time in the long run.